Do people ever come in and have things done to their nipples?
Oh yeah, so I do that a lot.
What's that?
So we do nipple height reduction.
Nipple height reduction?
Yeah.
What? Because of how far they stand out?
Yeah. So I had a patient. She was in church doing the collection in church.
Wait, say that again. So your patient was in church?
She was. Yeah, she does the collection in church.
Okay.
And had large nipples.
Why was she collecting?
So was concerned about.
In here, sir. No, sorry.
Yeah. So was concerned about the height of the nipple, so we reduced that, and it's really common.
But isn't that a very sensitive area?
Well, you can do it in a way that reduces it, so you still have sensation.
Just chop the top off.
Well, so that's one way to do it. I do something called a top hat technique.
Okay.
So you basically take out the middle bit of the nipple and you scrunch it down, so you still have sensation. The ducts still work.
I thought people like the pert nipple look.
Yeah, but sometimes they're really long.
It's too much. You can hang a hat on it. Yeah.
Can be like. Exactly that.
Interesting.
So so we do lots of so nipple height reduction, areola reduction.
Okay. And how does one do that?
Well, the thing with the areola reduction is often as part of a breast reduction you'll do it.
Yeah.
But if you patients say they don't like the size of that areola, you can reduce it by hiding the scar within the nipple,
right?
So within the areola. So you can you take out like a donut of skin and scrunch it down.
Ooh. What about design of vaginas?
So labiaplasty, do lots of labiaplasty.
But is that most common for post-baby? Or people just...
No, congenital, again, asymmetry. So patients will have like one labia longer than the other.
Does it do anything to feeling down there?
No.
Nothing, it doesn't affect any of that?
People have filler there, so you can put filler in the labia.
I've heard about this. That's a little
again,
odd.
I've not done. Well, I put fat in a couple of times.
Really?
Which is like a permanent filler.
Yeah. What do you think the current trend at the moment is?
So smaller breasts for sure. Is much more common now than what it was 5-10 years ago.
What's the youngest you've had come in for a breast, any sort of breast surgery?
We can't do surgery until people are 18.
Yeah.
In the private sector, it's just the rules. So you have patients who've had significant breast asymmetry. So I had a girl, she was a hockey player, international hockey player with huge breasts.
Yeah.
And really getting in the way. And it's quite a functional surgery, but we couldn't operate until she reached the age of 18.
Yeah.
But she had to play from, she was fully mature, grown, understood exactly what was going on, had a very valid reason for having surgery.
Yeah.
But we waited until she was 18 and did a reduction on her.
Would you recommend people wear bras, or is it fine to not wear a bra if you don't need to?
Wearing a bra, particularly post-op, or in fact, any time.
I'm actually asking for myself because I fucking hate wearing one.
Yeah,
but I don't know if it
that's a personal
people.
choice, so
fine.
I think if you hate wearing a bra, that's fine.
But I'm not going to get saggier boobs from not wearing one.
You probably will.
What?
Yeah.
Excuse me, would you mind? I'm just going to put my bra... But what, even if... Really?
Yeah, because if you think about it, what a bra does, it supports everything.
Yeah.
And over time, gravity will stretch everything out, even if you don't have large breasts, the skin will change.
Well, I'll be quitting smoking and coming to you. What puts you at high risk of potentially getting breast cancer?
There's lots we don't understand about breast cancer.
Yeah.
The biggest thing is genetics.
Okay.
So obviously, if you have a strong family history of breast cancer, that puts you at higher risk.
Yeah.
Generally, the rule is if you have 2 female relatives on your female side who've had breast cancer, you are at significantly increased risk. We don't know if lifestyle changes and things like that increases your risk of breast cancer. There's lots of things you'll read about. Certainly breast implants themselves have never been shown to increase the risk of breast cancer. There was a lot of discussion whether having fat transfer to the breast increased the risk of breast cancer.
So with fat transfer, it's different obviously to filler. If I was to have it, so I could get fat transferred from somewhere else just into my boobs.
So fat transfer.
Is that dangerous?
No. Fat transfer is great if you want kind of half a cup size breast increase.
Oh, now we're talking. How much does that cost?
So you got to have enough fat to transfer. That's the thing. So you have to have quite a...
The inner thigh?
You've got to take a reasonable amount. And also you've got to have quite a tight breast envelope to put it in. So it works really well on top of breast implants. So I do a hybrid or combination breast augmentation. So where we'll put a modest breast implant, so it's not heavy, and then we put some fat in to create a custom cleavage or bring the cleavage across.
Yeah.
Fill the breast at the top. That's when it works best because you've got a nice tight place to put the fat.
And where else does one get fat injected to on their bodies? Everywhere from
so
one place.
Hip dips is quite a common area.
What the hell is a hip dip? I thought it was an exercise.
Is around the side here.
That thing.
So often women will have after abdominalplasty or and they'll go in and then they'll sort of go. So they go down like that, then out, and then in again.
Yeah.
And then out to the thighs, and you can graft that area.
So it just
really
goes
nicely.
Like
so
that.
So you get a really nice curve. So you have a following curve from it follows the chest wall all the way down, then out again, and you can graft that area. That works really well.
Oh my god!
Facial fat transfer.
Facial fat.
Really nice. Instead of fillers, you can as people age, they lose fat from the temples across the top of the brows, this area. We can factor off there.
It's a lot, isn't it?
Well, it's a permanent filler, right? So you don't have to go keep having
And
fills.
that lasts forever?
Lasts forever.
I'd never even consider that. And can you get it in your lips?
You can put it in the lips. The problem is if you put it in your lips and then you put on weight.
Back to blowjob
lips will get bigger.
I know what you're saying. Yeah, Christ.
You know.
Okay, and now another surgery you do, which I have slightly been trying to get my head around, the corset.
So it's part of an abdominoplasty surgery, right? So typically after you've had kids,
it's not just a vanity, the beauty.
No, it's normally when you can do it without, like if you lost a lot of weight. So, but if the abdominal wall is lax and loose, like the muscles, six-pack muscles, what you can do is tighten them up again. So you can do sutures down the middle, and that's pretty much what everyone does as part of an abdominoplasty.
Okay.
What I do is take it one stage further, and we do multiple layers of repair. And what that does is it really shapes the waist. So we do stitches down the side, it narrows the waist here, so it can help give you more of an hourglass shape.
Oh my God.
Usually combined with abdominoplasty and liposuction. So it's really, what it does is it reinforces your core. So improves back pain, and if you're weak at the front from having 2-3 kids.
Does one's body really? Because you look at I've looked at certain friends who've had kids and their bodies don't go back to looking pretty similar to how they were before, and then some people's don't. Do your hips get wider? What actually does happen to your body?
So again, it's variable, right? So the fitter you are pre-op, and maybe also pre-birth, the stronger your muscles, the more that they're going to go back.
Bounce back, okay.
You know, typically, if you're young and like with the first child, it tends to go back quite well.
Quickly as when you're older.
It's if you have like 2-3 kids, each time it stretches a little bit more. And you probably, it's very hard to keep up in terms of exercise, keeping fit, once you've had kids and all of that. So typically it's the multiple pregnancies that can lead to slightly more laxity. But as you say, everyone's different. I have patients... In fact, patients who've had abdominoplasty have another child and they bounce back really well.
Really?
Yeah, so it doesn't stop you having
That's quite good,
kids.
actually. What's the best thing that's non-surgical that one can do to keep the elasticity of your skin?
Diet, nutrition.
Yeah.
Don't smoke. All of these things are like...
Non-smoking's cropped up quite a lot in this conversation.
Yeah, I mean, it's people smoke and it's fine, but it's
what
more...
is the real... I mean, other than my sweet lungs... What is it actually doing to my skin?
So what smoking does, the reason I worry about it for surgery is it constricts the tiny blood vessels in the skin, right? So nicotine is a vasoconstrictor.
Okay.
So if you're doing a breast lift, you're reliant on the little blood vessels supplying the nipple.
Okay.
And if those little blood vessels are constricted, right, so there's no blood going through them, and your oxygen carrying capacity of your blood is lower because you've got carbon monoxide and other substances in the smoke.
Yeah.
That there's not enough oxygen getting to the wound, so it's not going to heal well. That's so. And also it's the same for facial aging and the perfusion of the skin. If you've not got the oxygen and the nutrients going to your skin, your skin ages faster than if you do have the oxygen and the nutrients. So nutrition, collagen is great for skin healing and for general skin health.
Okay.
There's also lots of non-surgical treatments.
Well, actually, I was going to ask you because I've got a lot of messages from people asking what is the sort of list of non-surgical stuff one can do.
So Botox is great.
Yeah.
It works.
Quick one on Botox. Is it preventative or is that a load of rubbish?
So I don't believe it to be preventative.
Yeah.
If you give Botox from an early age, what you do is you reduce the bulk of the muscles.
Okay.
So if you're not using your muscles, like your facial muscles, they're going to get less powerful, so you have less wrinkles.
Okay.
It's preventative in a way in that it's weakening the muscles, so you're not getting, they're not moving, you're not getting the lines. But to start Botox at the age of 20, I think it's unnecessary. Botox,
do you? Okay, that's interesting. You said no because I remember when I first got it, I was about 28, and everyone goes, "God, you're late to the party," and I thought, "What?"
Yeah.
But I was young still.
I know.
So you'd advise better.
But people go out and have it, don't they, from that age, and it's not something that does harm.
When does one physically stop growing?
It's highly variable. It depends on lots of things, how you react to the hormones, what your hormone receptors are, what your lifestyle is like.
Yeah.
Lots of things. But in terms of you see people whose height increases at the age of 19, 20 still. Obviously most people are done by then.
Yeah.
But it is
I only got boobs
variable.
at 22, which is why at one point people thought I had a boob job. They're now fucking shrunk, but
anyway. Weight change will change your breast size, and particularly if you've got larger breasts over time, they'll continue to grow.
Yeah.
So you ask when people stop growing, the breasts will probably never stop growing if they're very large because they're going to drop and get fuller over time.